So when I was about 19 years old, I took a real bad spill skiing and I lost the ACL, the anterior cruciate ligament, in my left knee. And while it has never really given me any problem in the past because I followed the direction of Dr. Jim Parks, the orthopedic surgeon who talked me out of getting knee surgery at that time, because he said I'd develop arthritis because they had no arthroscopic surgery back then. He said, just make your quads strong and your knee will be stable. And that's been true up and through the first and second foot surgery and COVID, which I really couldn't train legs with any real strenuousness. And so now I'm at a point now where I'm just starting to get my legs back under me, so to speak. But my left knee has a lot of looseness in it, a lot of laxicity. And so day before yesterday, I was on the bike, and my bike with a full gas tank weighs almost 800 pounds. And I had to come to an abrupt stop, and I drove my left leg down into the ground as the bike was still stopping. And I tweaked the outside of my knee, and it hurt me really bad. And so yesterday I started this process. And after yesterday's injection, the pain went away immediately. And this is a fact, no bullshit. And I'm going to show you how to do this. But basically, what I'm using is an IU of growth hormone and 1 milligram of BPC 157. And while I don't have access to any type of ultrasonic devices where I can do an ultrasound, ultrasound guided into the capsule joint, I find that there's a couple spots in the knee that I place the injection, it seems to work. And I'm going to show you that right now. So maybe you can experiment with this as well. So I've already alcohol swabbed the area of the knee that I'm going to inject, and I'll show you that in a second. This area of my knee gets puffy whenever I injure my knee, and some of you may recognize this on your own knees. When you injure your knee, the outside front of the knee, to the left, if it's the left knee, it gets puffy and hard, like you could press against it. It feels like it's rubber. That's fluid from inside the knee pressing against the outside of the knee. And since I just touched my knee, I'm going to just alcohol swab it again. Because when you injure your knee, fluid builds up inside of it, and you usually see it pretty pronounced in two spots. This spot I'm going to show you now, and then the back of the knee, which is called the popliteal. And when you have a big puffy spot back there, it's called the popliteal cyst. But I'm putting it here because this is very close to where the injury, where I feel the pain in my knee. Okay, so stand by and I'll give myself this injection and you can watch. And so that's that little puffy spot. Many of you recognize it in your knee. The goal is to take a very short insulin needle and just push it right in. Push it all the way in, and then release your peptides.
What peptide?
I already talked about that.
Okay.
There's a whole video in front of this. So keep it going. What I want to say here is that the pain is not as bad this morning because I've been doing this, but the day that I did it, the pain was excruciating, and I literally gave myself this shot and took about a dozen steps, and the pain was gone. And we also covered the use of BPC 157 directly injected into the knee with Dr. Lee, I believe his name was. So wasn't that his name, Dr. Lee, the guy who wrote the book about peptides? Yeah, I'm pretty sure it was a Dr. Lee. I apologize for not remembering your name. I've done 3,000 shows. It's hard for me to remember all the different guests I've interviewed over the years. But anyway, he talked about a study he produced using BPC 157 directly injected into the It was intra-articular, so into the capsule joint of the knee. Now, I doubt that I'm getting into the capsule joint here, but I'm getting into the synovial fluid and possibly the lymph fluid that seems to respond to the injury that makes my knee puffy and stiff and uncomfortable. So this is not intra-articular. I would call this localized, a localized injection, so that the peptide is being utilized and picked up by the receptors closest to the injury. And it works. And you can give this a try yourself. And you don't have to use growth hormone. If you don't have a prescription for growth hormone, that was 1.6 IUs of growth hormone. My prescription is for 0.8 IUs 5 days a week. And so I doubled up. So that's 1.6 directly into the knee, along with 1 full milligram of BPC 157. And I'll continue to do this about every other day to give it a chance to do its thing before I put another injection in there. But I can tell you, I've done this before, and my knee is going to feel great in just a few days. I hope this helps some of you out there with knee pain. Thank you.